Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to talk about I'm just calling it the 3 secrets to PRN, getting rid of PRN visits or as needed visits. I want to tell you a little bit where I got this from. This was from one of the workshops that Cindy Pezza did, and she talked about the importance of not having PRNs, meaning as needed. And I'm guilty of this just as everyone else. And I just been writing down notes, kind of keeping track of some things. And over the last couple of weeks, just to try to improve it, because whatever we track is going to improve. So here are a couple of the secrets that I found. Some people don't like the word secret, but basically it's just kind of something that'll get people inspired or interested to read about this. Secret number 1 is all new patients should have a follow-up. And I was guilty in the past of not doing this. For example, someone came in for nail fungus. I would say, take a nail sample and we'll do everything else over the phone. Whereas the new patient is the easiest patient in our office to get them to come back. And the longer the space between having them come back, the kind of the less interested that they're in. So that's the first secret. The second secret, I would say, would be we have to give value when you make the follow-up. And this is something that I used to be guilty of. And my partner, we've talked about this before. A lot of times you would have canceled follow-up visits, right? So the follow-up visit was scheduled, and the patients would cancel them, and we're like, why? Well, what we find out over time certainly could be the copay, it could be other things, but the main reason is they don't understand why they're coming back and what's the value that you're going to give them in that follow-up. So, for example, get that expectation. I'll actually give some experiences here or some examples here in a little bit of what we do. But one simple one is with a diabetic, right? Every year they come in. Maybe they don't need to be seen every 3 months in the office, but they just need to see you once a year. And you just say, hey, I need to see you once a year. We're going to do a comprehensive diabetic foot exam, evaluate for any risks. And a lot of times I'll give them my booklet. I have a little booklet I have on diabetes, and then they'll be getting my messages about that. So that's the secret number 2, is show them kind of the why. Don't just say come back. They need to know kind of why they're coming back, so why it's important. And then the third one is yearly follow-up. So yearly follow-up is key, and this can be done for many items such as orthotics, diabetic exams, cyst evaluations. You put it in the chart and the reason for the follow-up. And so I wrote down some things here, and as I've been thinking about it, this is just the last week of patients. Okay, so for example, there was a patient that had a cyst, and this cyst was large. I drained it. It didn't seem to come back for them, or it came back just a little bit. And I wanted to just evaluate that to see if it was going to get bigger, because it was kind of impinging on a nerve on the foot. So I'm going to see them back in a year for a cyst follow-up. There was a 90-year-old patient, and she injured her nail, and she was concerned about it. When the patient was concerned, she was concerned how it would come back, if it was be attached, if it would get ingrown. I made a follow-up for her where I normally wouldn't have done that. I would just say come back if there's any need. But since she was concerned, I made that follow-up, okay, based on the patient's need. There was also a patient that was feeling better, but she was still doing physical therapy for Achilles tendonitis. And one thing I tend to do with patients, if I want them to come back, so I'm going to want them to come back, see how they're doing the PT, and I said, well, I want you to bring in your shoes, your new shoes that you're going to get, and your orthotics. And a lot of times I'll do that. So a lot of the recommendations we do are pretty simple, right? You're going to go get either a new shoe and an over-the-counter orthotic, try some foam rolling, and then I want you to come in. I'm going to say, how long is it going to take you to get those things? Let's say it's a week. And so, okay, I'm going to see you 2 weeks after, because I want to see how you're doing. And I got this idea from, actually, there was a lecture from a dermatologist, and what he noticed is that patients that were seen more frequently were more compliant with using steroid creams. And so, for example, it's the same thing with what we do. So if I'm watching them every couple of weeks, they're going to be much more compliant to their foam rolling or stretching regimen. We do more foam rolling, and the shoes, and because I'm checking up. Basically, I'm keeping them accountable. and so I'll see them in about 3 weeks for that. There was another patient that came in, hammer toe. I'm not going to do hammer toe on the surgery. They wanted to try a Boudin splint. Usually I would say try the Boudin splint or the crest pad and come back. Never. But since I was thinking about this, I said, well, let's see how you're doing with the shoe changes, bring in your new shoes, try these Boudin splints. We'll see you in 2 to 3 weeks and see how you're doing. So these were all new patients that normally I would never follow up. So what I'm trying to do is all new patients, I'm having them come back in sometime, okay? As well, a patient that came in, they were concerned about a limb length discrepancy. And I usually, once again, I'll put them in a heel lift or something else like that, something simple, educated on them. They thought they needed an external lift. It was just they were wearing the wrong shoe. And usually I would say, okay, try this and come back never. But in this case, I'm seeing them back in a couple of weeks. So it's having more return follow-up visits, and it's filling my schedule more. But it's basically, we try as much as we can not to just have, well, come back as needed. I try to schedule and then show the value and then give them homework of what they need to do. And giving them that homework is essential. And one of the tricks that I found that works well for that is this treatment checklist that I use. So I print out I have this checklist. It's almost like a prescription pad, and it gives them what they're going to do and what I expect them to do for the next visit. So it gives them some accountability. Anyway, those are some ideas of some, I guess, secrets you could call it, to having less as needed visits. Okay, guys, have a good one. Bye-bye.